So thank you very much for inviting me to talk about what AANP has is a toolkit. And the first part of the toolkit is just simply the guide to the new nomenclature, which I know that you've all had some great discussion about already throughout this evening. But it's just a quick handout, easy. You can share it with other people in your clinic to make it easy for you. You can see the former nomenclature, characteristics, and then they just spent some time talking about that FIB-4, and it talks about what's low risk, what's high risk. Again, the goal behind the two parts of this toolkit was just to be a quick reference available for you in clinic, either after attending something like this or to share with other people in your clinic. And so this is the final part, and this comes from the consensus group that identified the 5 specific cardiometabolic risk factors, which we just heard them talking about at the end of that group dynamic there. So I'm not going to go into this. I just wanted you to see that this is available in the first part of that toolkit. In part 2 of the toolkit, what I find the most useful about this is that it helps so much in my patient teaching. And so there are 6 parts to it. You can see here you go from screening to pathophysiology, epidemiology, diagnosis. There's a specific part of patient education, and then bibliography, guidelines, and more on management. So all of the screening things that you've just been hearing about through the evening, and again, we're just very wonderfully overviewed as we listened to that panel discussion. I could have listened to them, I think, for another hour pretty easily. As an obesity specialist, I found them absolutely amazing to listen to. But we can see that all the screening is here for you. This slide I use, or this part of the toolkit, I use a fair amount in clinic when I'm talking to patients, especially if they're just learning about what it means to have metabolic associated fatty liver. It helps them kind of see what progression might look like, but it also helps them understand that if they start treatment, that they might be able to slow or stop the progression. So I do use this part of the toolkit, even though the words aren't meant for patients, it can help them see it a little better. Diagnostic tools are here. Again, we heard quite a bit about these just in the last panel discussion. And I like the tips just to remind me of things. But I think my favorite part of this page on the toolkit is the actual identification algorithm. Just helps me remember, at least in the US, what I need to order, because I don't have to refer to a specialist to get an AST or an ALT. In fact, in the great state of Arizona, my patients can order all of this on their own. And I've even had patients show up new to my clinic that come with all of their labs, including liver labs. So it's always kind of interesting to have that happen. We have direct patient access to labs here. Why I think this is important, and in the handout that I hope you all got for this, I actually went back and picked out the link. So if you're using the PDF of this on a computer, you click on the red box and it takes you to the Harvard Healthy Eating Plate. But just in case somebody doesn't want to go download the toolkits, I still wanted you to have these links. So I actually typed them all in to each of these underneath the red boxes so that you would have them in the handout from this presentation. These are phenomenal resources to give to your patients. You know, when we talk about telling patients to avoid excess sugar, sometimes they're like, okay, so I'm not supposed to drink Mountain Dew. But there's so many other things. And this handout is absolutely one of my favorites, probably with a little bit of bias because of my background as an obesity specialist. And then finally, there's the information, again, for patients and us on management. And I know that some of you will look at this and you might kind of roll your eyes at motivational interviewing resources, but it's really what we all do. We just don't use that name of it. And so I thought it was worthwhile, again, to put the highlighted links here in case you don't go and get the all complete toolkit, because this gives you some tools on how to do motivational interviewing quickly in your practice. And our Canadian colleagues, at least in the obesity world, have demonstrated that obesity can be treated in primary care in 5 minutes or less, primarily using motivational interviewing resources. So that's why I thought it was important for those to kind of be highlighted here. And then again, because of my bias with obesity, we do have a link for obesity management guidelines. And it was nice to hear all of the specialists talking about the importance of not using obesogenic medications if at all possible, and helping patients understand that treating their obesity is a big part of treating their liver disease. So I know that was quick. It was supposed to be just an overview of what this particular handout, these two toolkits, could provide for you in your clinic. And AANP, again, is very thankful and grateful that you guys would invite one of us to come and just show you what this toolkit is and let you know that the toolkit is free. It's on the website. Anybody can download it and use it. And we hope that some of you will, in fact, do that and be able to utilize it to help you in your practice as you're taking care of patients with liver disease. If you have any questions, please feel free to email me at npfromhome@gmail.com.